This video shows how to collect a hair sample from toddlers with curly hair using the small bits method. Supplies for hair collection include a large hair tie, small rubber bands, hair clips, and a foil sheet. We recommend using sharp scissors capable of cutting close to the scalp. When collecting a sample from participants with curly hair, use a wide tooth comb or even your finger to isolate a portion of the hair as perpendicular to the ear as possible. Do not use a fine-tooth comb that can easily become tangled in the hair. Use small clips to isolate the segmented hair. This allows the sample collector to cut away only the intended area of hair and keep stray hairs away from the scissors. This is important when using an uneven part. Next, using a tail comb or any comb with a blunted smooth tip, weave small bits of hair along the part line in a zigzag pattern to isolate 3 to 5 small sections of hair. Keep the sections small. It is okay if the small bits are not identical in size or do not fall in a straight line. To avoid nipping a child who may move suddenly, for this step we do not recommend using the tips of the scissors to isolate the sample. When working with young children or toddlers, it is important to communicate to them to stay as still as possible. It is even more important to be patient with them. Try asking the child to freeze while the sample is being collected, or ask a parent or another adult to assist in distracting the child if needed. Parents or other researchers should avoid standing behind the child. This can easily cause distractions and elicit the child to turn their head. Do not rush the child, and instead give toddlers or babies plenty of time to adjust and to get comfortable with what is occurring. In order to assist, allow parents or another research assistant to sing songs, make silly faces, or even distract the child with objects. A mirror or cell phone is a great way to distract the toddler. Have them make silly faces or take a picture. It is also a way for them to see what's going on. Using a small rubber band, tie off the parted segments of hair. The rubber band should be close to the scalp so that lab technicians know which end of the hair sample is the scalp end. Gently pull the sample taut before snipping the segmented hair strands. Toddlers and babies may move suddenly, and it is crucial to avoid nipping the scalp of the child. While it is necessary to work as close to the scalp as possible, it is more important to work carefully and slowly to avoid nipping the child. Depending on the number of hormones being assayed, repeat this process on the other side of the part in order to collect 100 to 150 strands of hair, about 4 to 5 times as much as seen here. Working slowly and carefully while being sure to communicate with the child, the sample collector has obtained a neat and tidy sample that has left no visibly missing sections of hair. The lab technician has isolated the 3 centimeters of hair that are closest to the scalp and weighs the sample precisely. The sample collector obtained 30 milligrams of hair. This is enough to assay 1 hormone and check for accuracy.